The scheduling view in PowerChart allows users to view scheduled appointments by resource without having to launch the Enterprise Scheduling Management or ESM application. This is useful for clinicians in an outpatient setting to manage clinics. To access the scheduling view, click Scheduling in the toolbar. To set up the clinic list for the first time, click on No Resource Selected and click on Add Other. This will open the Resources search window. Search for the resource as it appears in ESM and click Find. Select the correct resource and click OK. The patients who are scheduled into that clinic for today will load. Various details about each appointment can be seen in the different columns, such as the scheduled time, the duration, the patient's details, name, age, and gender, various appointment details and scheduling comments made by the AO, the appointment status, so if the patient has been checked in yet on ESM, and the reason for appointment. In some bulk billed clinics, the letters BB may display here to indicate that the consultant is required to see these patients to be able to claim bulk billing. If any comments have been made, the post-it note icon will become active and be clickable to view comments made. Comments added here are not part of clinical documentation and do not feed into the patient's chart. The date in the top right-hand corner can be used to view past or future clinic lists. The date displayed can be changed by clicking on the arrows or selecting from the calendar. It is possible to select multiple resources to display in Scheduling View simultaneously. You can add additional resources the same way we added the first. Once added, be sure to check off all selected resources and click Apply. When multiple resources are selected, the appointment time column will also display the allocated resource. Additional information can also be viewed by hovering over things like patient information, scheduling comments under appointment details, or reason for appointment. We are currently viewing our clinic using the Day View. Another way to view the clinic through Scheduling View is by using the Calendar View. This can be set up to show just today or the whole week by using the buttons along the top. Only one resource can be displayed using the Calendar View. To open a patient's chart from either view, simply click on the patient's name and confirm the encounter that it has been opened to. This will be the patient's outpatient encounter for that clinic if the patient has been checked in, a pre-arrival encounter if they have yet to be checked in, or an inpatient encounter if the appointment is for an admittable procedure and the patient has been checked in. Once confirmed, you can complete any documentation required for the appointment. Upon completion of the appointment, simply close the patient's chart using the small X in the Patient tab or click Scheduling in the toolbar. Remember to refresh to see any actions that have been completed in ESM since last time you viewed Scheduling View. For instance, if any new patients have been checked in, their status will change from confirmed to checked in. If you require further assistance, please call Adoption Services on 3176 8800.